Hello and welcome all of you to my lecture. We are dealing with routes of administrations. We have already seen different routes of drug administrations that are local and systemic. There are some local routes, again I'm repeating, these are topical, deeper tissues and arterial supply. And there are systemic route. We covered one aspect of systemic route, that is oral, subcutaneous and rectal in one lecture. Now we will go ahead with further routes. Let's talk about one more route of drug administration, that is transdermal route. As the name suggests, it's having dermal. Okay, so it's have to do something with skin. So this route is basically used to transfer the drugs through the skin. So this is a route of administration, achieves the systemic effect by application of drug to the skin. So here the drug is applied onto the skin and usually via transdermal, that is stratum corneum. So transdermal route is the main things, and which is been mediated through adhesive patch. So as this figure suggests, it's a transdermal patch where it's a patch like structure or a sticker which is need to be applied on skin, and through skin the drug gets absorbed. So what are the advantages of this kind of route? Is constant rate into the systemic circulation. So here the drug which is been released from this sticker or a patch is gets absorbed through the skin and remains in the system for longer time. And secondly, constant rate at which the drug is being delivered. Adhesives provides smooth plasma concentrations without much fluctuation. So as I discussed, there are one more advantages, that is this delivered drug remains in the blood for longer time, so there won't be any fluctuation in drug concentration. So concentrations remains above the therapeutic level for longer time. One more advantage is first pass metabolism is avoided. So here, as we know, in the earlier routes of drug administration, we discussed what is first pass. When you introduced any drugs orally, the drug gets initial metabolism into the liver, okay, and onto the intestine, and eventually the remaining drug reaches to the systemic circulations. Okay, so if you administer 100% of drug orally, only 75%, for an example, reaches to the systemic circulations, and that 25% get lost due to first pass metabolism. So here there won't be any issue of first pass metabolism. Here you are applying drugs directly onto the skin, and through skin it gets absorbed directly into the system. Better patient compliance. Obviously patient feels better if you ask them to just take a drug and not to take orally or injectably. So it's having a better patient compliance. But disadvantage is they are expensive. These kind of patches are a bit expensive in comparison to oral tablets. So these are advantages and disadvantages of transdermal route. One more disadvantage is local reactions. It produces local irritations and redness in few cases. So these are transdermal routes of drug administrations. So this is a structure of that particular sticker, or I would say in medical terminology, adhesive patches. So these are transdermal drug delivery system or transdermal adhesive patch. So if we zoom this patch, this kind of different layers we can see. So which layers are there? So first, from the outer side, if we talk, so first there is a backing film. If we go inside, there is drug reservoir. So this whole thing here, the drug is being kept. So this is a drug reservoir area, okay, and if drugs not gets outside, so for that they are having this backing film. Next layer is rate limiting or rate controlling micropore membrane. So this yellow thing is rate controlling membrane, where through which the drug released, okay. And there is an adhesive layer as well. Beneath that yellow, there is a adhesive layers through which that sticker gets remain or gets stick onto the skin, and through this pore the drug gets released, and it is been absorbed through these capillary dermal capillaries and goes into the system. So this is how the layers been designed. So backing film followed by a drug reservoir, followed by the micropore membrane, followed by the adhesive layer. So this is a structure that is frequently asked in your examination of this transdermal adhesive patch. Which drugs can be given through this transdermal patch? There is important questions that is asked in examinations. There are nitroglycerin. We use these drugs during acute attack of angina or myocardial infarctions. Anti-emetic drug, very frequently use scopolamine. Many of the patient gets motion sickness while they travel, so this kind of scopolamine patches is been applied and it's quite useful rather than taking drugs. Fentanyl patches, it is drug used most commonly for pain killing effects. So these are opioid drugs, usually in post-operative cases or cancer patients where there is lots of episodes of pain there. To reduce that, they use these fentanyl patches. Estradiol, this is one drug that is one of the part of hormone therapy. So to give the hormone and maintain the level of hormone in blood, they just applied the patch of estradiol. And nicotine patches, we already know, patients who need to withdraw the cigarette smoking or want to stop the cigarette smoking, they gradually doing that, and for that one formulation, that is the patches, they applied the nicotine patches, and so nicotine remains in their body for little bit of longer time. Where you need to apply? You can apply these patches on upper arm, chest, abdomen, and mastoid region behind pinna. So absorption increase by oily base, occlusive dressings, and rubbing preparations. Usually effects last for 1 to 3 days. So these were the things about transdermal routes of drug administrations. Now let's talk about inhalational route. As the picture suggests, here we need to give the drugs which goes directly into the respiratory systems or the lungs, and through which it gets absorbed. So it's a rapid delivery of drugs across the larger surface area or the mucous membrane of respiratory tract and pulmonary epithelium. So here the drug goes directly into the lungs, and through the pulmonary epithelium it gets absorbed. So here it produces rapid actions, as rapid as IV injection. So it's a very rapidly acting drugs, direct acting drugs, which has been given through inhalational route. You can give a lot of gases, drugs which is in gaseous form. For an example, anesthetic agents been given through these inhalational routes. It is very effective and convenient for patients with respiratory diseases like asthma or COPD patients. These drugs are quite beneficial. They can go directly to the affecting site. Because this drug is delivered directly to the site, so the systemic side effects are less. So here the drug do not goes directly into the blood. Here it goes directly at the site, and then it goes into the systemic circulation. So systemic side effects are quite less. Which drugs you can give? We can give drugs like salbutamol, which is being used in asthma, or corticosteroid, also used in asthma to prevent the asthmatic attacks. What are advantages of its? Control administrations possible. So depending upon the severity of that particular attack, the doctor may advise you or prescribe you to take in a controlled manner. But disadvantages is there are some gaseous forms which are quite irritant. So that irritant vapors may causes inflammation of respiratory tract and increase the secretion. So if we give some of the anesthetic drugs through this route, there are chances that some gases or the vapors of those gases are quite irritant and produces quite a lot of respiratory secretions. One more route is nasal route. Okay, and that route also we've been aware of. The route involves administration of drugs directly into the nose. So the route we just talked about, that was inhalational, where the drug directly reaches to the lungs. Here the site of action is nose or the nasal mucosa. Okay, so here we need to apply the drugs on nose or the nasal mucosa. So this route provides administration of drug directly into the nose. So we use which kind of drugs? Nasal decongestants or anti-inflammatory corticosteroid we apply to the nasal mucosa. One more example of drug is desmopressin. We use this drug for the treatment of diabetes insipidus. So you need to, memorize few of the examples of that particular route. So two things are asked in your examination. One is different routes and which drugs are given through those routes. What are advantages and disadvantages? So these kind of questions are asked in your theory or practical examinations. We can also give salmon calcitonin, one more drug, or it's a hormone which is being used in a treatment of osteoporosis through this nasal spray. Abuse drugs. Cocaine is generally taken by intranasal sniffing. We already know and we have seen in quite a lot of movies and web series is that people sniff a particular drugs, and those drugs being sniffed and applied on the nasal mucosa and through which it gets absorbed. So thank you. These were the a few of the routes, and as we go ahead, we'll talk about other routes of drug administrations as well. Thank you very much.